My name is Ken Griffin. I'm the CEO of the Australian Primary Healthcare Nurses Association, or APNA. APNA is 22 years old this year, and our mission is to create a healthier Australia through best practice primary healthcare nursing. APNA was involved in the Strengthening Medicare Taskforce through our president, Karen Booth, who sat on the task force itself. That follows on from a long line of task forces, including the 10-year primary healthcare strategy task force. So you could say we're old hands at advising the government on how to best use the largest workforce in primary healthcare, which is its nurses. There's 96,000 of them between aged care, community health, school nursing, general practice, correctional services, and the list goes on. So APNA has been advising the government and the previous government for a long time now as to how to get the most out of the largest workforce that works in primary healthcare settings. There are so many issues facing the largest workforce right now, and some of them relate to workforce shortages and just the sense of fatigue and burnout that have come from the last couple of years of COVID. But it's more than that. This workforce, which is the largest in primary healthcare, actually reports to us through our workforce survey that a third of them are never or rarely used to their full scope of practice. So a third of the 96,000 nurses in Australia say we could be using them better, including their skills and experience. The average age of a nurse in Australia in primary healthcare is 48.5 years. They are very experienced, they're highly trusted, and they have the same qualifications as nurses in hospitals, yet we use them less. We need to actually change how we utilize this workforce to make the country healthier. We also need to make sure that we're training more of them, because we do have some coming up for retirement in a large group right now. The other thing is we need to make sure that curriculum trains nurses for primary healthcare, where they can do all the prevention work that keeps people out of hospitals. And that means they need to see primary healthcare in the curriculum when they're training as an EN or an RN, but they also need to have placements as well, so they can actually put those skills to practice in primary healthcare settings. And that doesn't happen nearly enough at the moment. This budget, APNA is calling on the government to do a number of things to help with this workforce issue and with the health issues that Australia faces. The first one is to help support the development of a primary healthcare placement program for students who are studying nursing, because they don't get that experience in primary healthcare. Giving them that first taste means that they'll have experience in the area and are more likely to consider it as a career option. We know from the placement program APNA is already running, which is smaller and only operating in a couple of states at the moment, that 7 in 10 students coming on a placement, having never experienced primary healthcare in their curriculum, say that they would consider it as a career option. And we know that 3 in 10 of the third years who go through actually get offered a job and accept it. The other thing we're talking about is actually having a campaign that positions primary healthcare, including aged care, as a really legitimate career option for nurses who, as students, are generally trained up for hospital. This would actually help bring people into the areas that are really struggling for workforce, in aged care, in general practice, in areas like school nursing and community health. And this will help us do prevention better, provide a strong pipeline of new generation nurses coming through, and actually help us prevent poor health before it occurs. The other thing that we're really calling on the government to do is to follow through with the commitments in the Strengthening Medicare Taskforce report. That's really important. The government won't have all the money it needs to follow through with all those recommendations, but there are some things it can do, including increasing WIP payments and strengthening the accountabilities around that. So the WIP incentive that goes to general practices helps nurses work to their full scope of practice rather than lower scope activities. This would be essential to actually solving that issue of nurse utilisation in general practice. But also we want the government to start putting in a concrete plan in order to bring about the recommendations from the Strengthening Medicare Taskforce. Within the medical model, we know nurses can do more to prevent poor health outcomes and the spread of chronic disease in our communities. The Self-Care Alliance, which APNA is a member of, has this proposal that we are supporting, which is really around nurse-supported self-care. And that's about actually having nurses trained to do more of this in-community work that prevents people from even hitting the medical model of care, which means they need to be diagnosed. If this gets off the ground and is supported by the government, it'll be the first step to going beyond the discussion of people being referred into hospital because they can't be dealt with in a swamped healthcare system. It actually will be about stopping them even having to go to their doctors in the first place because they'll still be well. We know that nurses can actually deliver this really well. We know it's within their scope, and we know they want to do more of this work where they actually educate groups and individuals about health issues before they actually require a diagnosis. This is a really exciting initiative and one that we really commend to the government. There are so many issues facing healthcare in Australia right now. So other areas that the budget is going to need to address in some way is, and we'll start with aged care, we are not going to be able to fulfill the need for all the nurses that are needed in aged care under the new rules. The care minutes is a really good thing. APNA is highly supportive of these, but we need the right nurses in those aged care homes in order to provide the care that's required. And the workforce doesn't exist right now. So we need to help the government to make sure that that workforce is brought into being. The other thing is regional workforce and rural workforces need to be actually considered in the context of whether accommodation is available and affordable. We can't expect people to take the risk of changing jobs and moving to a rural or remote area and have the idea of accommodation up in the air. They've got to be seen as hand in glove. And that's also with placements when we're expecting students to see what it's like to work in rural areas. We also need to be looking at health more holistically, so outside the nursing space. The idea of dental and oral health, it's still a big issue in our country. We know that there is more and more of this preventative work in oral health, just like in chronic disease, that's lagging. So the government also needs to think about what are the policies that will enable as many workforces to get into the game, whether they're allied health, multidisciplinary teams, how do we deliver that care and catch up that chronic disease management and assessment that's gone by the wayside to a degree during the pandemic. We need to catch that up, otherwise we're going to see more and more pressure on hospitals.